Greetings and welcome to this module on fungus biology. In this video, we'll discuss about the different types of fungus in the pharmacological and the treatment aspect. If you master this module, antifungal choice becomes very logical and not recall based. You don't need to remember anything, just understand the logics and the concepts. So we'll discuss only what matters for therapy and not go into details of the microbiology. Let's get started. So clinical classification is basically for the treatment purposes is yeasts, molds, and the dimorphic fungi. In yeast, usually they are intracellular, unicellular organisms that reproduce by budding, whereas molds are multicellular and filamentous structures. They enlarge and reproduce by hyphae formation. And there are the other fungus called dimorphic fungi, which switches between mold in the environment and becomes a yeast-like organism in the host. This is called thermal dimorphism. So all the fungi fall into just three functional groups for the treatment aspect. So yeast are echinocandins and azoles plenty. Why? Because this is a yeast cell. It actually divides by budding corn and creates a new bud and then forms a new yeast fungus cell. So these are unicellular, reproduced by budding. So it easily circulate easily in the blood and candidemia. Structures are very simple, relatively simple cell wall. So examples are Candida species and Cryptococcus. So this depends on the thin cell wall, which is vulnerable to echinocandins, and the cell membrane has high ergosterol content. Those so azoles usually work very well because of the very slower growth, fungistatic drugs are effective. And bloodstream presence, if it is present in the bloodstream, only then you need a fungicidal drug. So exception is the Cryptococcus. Cryptococcus has a very thick cell wall called the polysaccharide capsule, which covers the cell wall. So because of this reason, echinocandins cannot reach the cell wall for its activity, so echinocandins fail. Whereas in Candida, cell wall is highly exposed, so echinocandins work. Echinocandins means Casper fungin, Mica fungin, and Anidula fungin. This single difference explains the same drug class works for one but not the other. So it is all based on the fungus morphology and the structure of each fungi that the drug works. So azoles and amphotericin dominate molds. So why amphotericin is still alive in 2026? It is a very toxic drug to human beings. It actually destroys cholesterol content of human cells in renal tubular toxicity. Even though all these are there, so it is still being used in 2026 in liposomal form because of the usage of this drug for resistant fungus and the uh, for fungus such as mucorales and fusarium. For mainly the molds are multicellular and filamentous, which divide by hyphae formation. And behavior is it is tissue invasive and also angio-invasive, invades blood vessels also. So, for example, these are Aspergillus, Mucorales, and Fusarium. So, Aspergillus have further subspecies Niger fumigatus and flavus, whereas Mucorales are Mucormycosis species. So mold architecture, so it has a very thick rigid cell wall. So echinocandins are a very weak molecule to attack it. Hyphal growth is in the longitudinal enlargement with rapid invasion. So always fungistatic drugs are not adequate. So you need a fungicidal drug. Vessel invasion is there, so it leads to high mortality risk. So hence needs an aggressive therapy. So these highway actually change the rules. The drug that we give should act at the growing hyphal tips to prevent its multiplication. It should penetrate deep into tissues, into the blood vessels, so that it acts and kills the fungus. And it should also work extremely fast. So in these cases, specific azoles such as voriconazole and fusoconazole can be used that way with caution, and amphotericin B can be used, which acts as a hammer-based drug. So it creates pores in the cell wall and lyses the fungi. So echinocandins, it is best used as an adjunct. It is not much of use in case of molds. Sometimes azoles work surprisingly well for dimorphic fungi. The dimorphic fungi exhibit a mechanism called a thermal switch. It acts as a mold in the environment in cold in 25 degrees Celsius. In human body, in warm temperature at 37 degrees Celsius, it acts as an yeast. So examples are histoplasma, blastomyces, and coccidiosis. So treating dimorph is simple because inside the cell body they behave like yeast and not mold. So it is ergosterol dependent, slow growing, and disseminated over time, and not based on the tissue penetration. So azoles are mainstay. Amphotericin can be reserved for severe disease only. So this is why histoplasmosis treatment is not the same as aspergillus treatment. So hidden driver, the main thing you need to understand is the fungal cell wall component. The beta 1,3-D glucan is present in the cell membrane, uh, cell wall, and chitin is present in the cell wall. If the cell wall is composed mainly of beta D 1,3-D glucan only, then echinocandins work fully. If the wall has a large amount of chitin content, then echinocandins may not work. This is also you must need to understand. So the wall is basically made up of beta 1,3-D glucan, chitin, other manoproteins and polysaccharide capsule. Especially for Cryptococcus, this polysaccharide capsules is very important because of which only amphotericin B can be used for this. So no memorization, just logic. Beta glucan is rich in case of Candida and yeast-like organisms, so echinocandins work really well. When mucorales, chitin is the dominant thing in the cell wall, so echinocandins fail universally. When the capsule is present, for example, like Cryptococcus, drug penetration is very less, so also echinocandins fail. When there is a thick cell wall, need membrane targeting drugs. Azoles are very selective and only work if the fungus needs ergosterol. These are the ergosterol content in the cell wall. Plasma membrane has ergosterol content. So only if the fungus needs ergosterol, then azoles can act. Fungus cannot bypass synthesis of ergosterol, then only the azoles can act, and fungus that cannot create pump to uh, excrete out the drug. So only in these cases azoles are sensitive. How fungi escapes azoles? Because altered cytochrome 51 enzyme, reduced ergosterol dependence and efflux from formation and biofilm formation, and by all these mechanisms, the fungus become resistant to azoles. So clinically, Candida has 3 to 4 species, of which Candida glabrata is dose-dependent sensitivity. In case of high dose, it becomes sensitive to azoles. Candida cruzi is intrinsically fluconazole resistant, so there is no role in giving fluconazole. So Candida auris is multi-drug resistant. So azole resistance is a biological strategy developed by Candida species and other species of fungus. It is not just randomness. So growth speeds, yeast and dimorphics are very slow growing. Fungistatic drugs are acceptable, whereas rapidly invasive such as Aspergillus and Mucor needs fungicidal and fast-acting therapy. This is why amphotericin is still alive in 2026, and why echinocandins are alone are dangerous in treatment of molds. So you must always know when you suspect a fungus infection in the patient, you must know whether it is a yeast or a mold. So in that case, whether there is a capsule present and there is a cell wall, what is the cell wall type? It is made up of beta glucan or chitin. What is the growth speed of the organism and the post-immune status, whether they are immunocompromised or immunocompetent. So all these aspects decides the drug that we choose for the fungus. So antifungal failure is usually due to the wrong class of antifungal drug, not because of the dose. For example, giving fluconazole to Candida cruzi is a big blunder, and again giving echinocandin to Cryptococcus is a blunder, and giving azole alone in mucormycosis is also a blunder. So in this video, we just got into the overview of the fungal common fungal types and the how the cell wall are made up of, how the cell membrane are made up of, and the type of antifungal agent that can be used in a basic overview. In the upcoming module, we'll discuss about each subspecies like Candida, Aspergillus, and what antifungal agent can be used for treatment of the same. So if you're new to this channel and like this video, do like and subscribe and share it with your friends. This is Medicine Beyond Harrison's. Let's meet in another video. Thank you for watching.